Numbness in the hands and feet might seem like something simple, a passing annoyance. But what if I told you that often this tingling is a clear warning that something bigger is happening in your body? Today you will discover why this symptom deserves so much attention and mainly what it might be trying to alert you to before it evolves into something more serious. Stick with me, because understanding this can change the way you take care of your health from now on. Many people ignore this sign for years until the numbness turns into pain, loss of sensitivity, or difficulty performing daily tasks. But in this video, you won't just hear explanations. With every cause revealed, you will understand how to identify the signs and what to do to act fast. And just ahead, in the next topic, you will receive essential information that can clarify what is happening in your body. Don't go anywhere. Why numbness should not be ignored. Numbness in the hands and feet happens when there is some alteration in the way nerves transmit information to the brain. This can involve anything from poor circulation to nutritional problems or more serious diseases. The important thing is to understand that this symptom doesn't appear by chance. It indicates that some function of the body is working improperly and needs attention. The sooner you understand the cause, the sooner you can avoid complications that many people only notice when the condition has already advanced. Many people try to live with the tingling thinking it is just tiredness, posture, or age, but this is dangerous. Numbness is the type of sign that, when ignored, can evolve into loss of sensitivity, muscle weakness, and even difficulty walking or holding objects. In today's video, you will start to understand, starting from the next topic, what the most common causes are and how each of them manifests. What you are about to discover now can be decisive in avoiding bigger problems. If this content has already started to help you, remember to like the video and subscribe to the channel to continue receiving essential health information. Cause 1. Poor circulation. When blood doesn't get where it should. Poor circulation is one of the most common causes of numbness, especially in people over 50. When blood doesn't flow adequately, nerves don't receive enough oxygen and start sending signals like tingling, heaviness in the legs, and a sensation of constant cold. Often this happens because of varicose veins, a sedentary lifestyle, high blood pressure, or even high cholesterol. Identifying this pattern early is essential to avoid complications in the future, such as swelling and persistent pain. Another important point is that poor circulation tends to worsen over time if there is no change in habits. The numbness might start only at the end of the day, but later appears even at rest. In the next topic, you will see how numbness caused by nerve damage is different and why so many people confuse one thing with the other. Understanding these differences is crucial to seeking the correct treatment and not wasting time with solutions that don't work. Cause 2. Peripheral neuropathy, damage that starts slowly. Peripheral neuropathy occurs when the nerves responsible for sensitivity and movement begin to suffer damage. This process can be slow and almost imperceptible at the beginning, but over time it causes numbness, burning, a sensation of pins and needles, and even loss of strength. Unlike poor circulation, here the problem lies directly in the nerves, which stop transmitting information correctly. It is common for the first manifestations to appear in the feet and gradually advance to the hands. The big challenge is that many people confuse neuropathy with tiredness or age, delaying the diagnosis. When it is not treated, it can evolve into strong pain, difficulty walking, and even loss of balance. In the next topic, you will discover how something apparently simple, like the lack of a vitamin, can lead to the same type of numbness, and why this happens more than one might imagine. This difference between causes is essential to understand what your body is trying to signal. Cause 3. Vitamin deficiency, mainly B12. The lack of B-complex vitamins, especially B12, is a very common cause of numbness and tingling, mainly after age 50. This happens because these vitamins are essential for protecting the nerve sheath, which acts like electrical insulation. When this protection weakens, nerve transmission becomes impaired and symptoms arise like numbness, weakness, tiredness, and even memory changes. Many people live with these signs for years without imagining that the cause lies simply in their diet or the inadequate absorption of these nutrients. Another important point is that B12 deficiency can occur even in those who eat well, especially in people who use certain medications like omeprazole or who have stomach problems. The longer this lack remains, the more intense the symptoms become. In the next topic, you will realize how spine problems can generate numbness in a totally different way, and why this is one of the causes that most surprises those who suffer from this symptom. If this video is helping you understand your body's health better, take the opportunity to leave your like and subscribe to the channel. That way you won't miss upcoming content that can make a difference in your day-to-day life. Cause 4. Spine problems, compressed nerves. Spine problems, such as herniated discs, arthrosis, or natural wear and tear of the vertebrae, can compress nerves and provoke numbness in both the hands and feet. When this compression happens in the cervical region, it is common to feel tingling in the arms and hands. When it occurs in the lumbar region, the symptom appears in the legs and feet. Many people believe that back pain is the only sign of a spine problem, but, in truth, numbness can be the first warning, appearing mildly and sporadically before becoming more intense. With the passing of time, this compression can generate loss of strength, difficulty walking, a sharp pain sensation, and even imbalance. That is why it is so important to observe when numbness appears after sitting for a long time, carrying weight, or performing repetitive movements. In the next topic, you will understand how one of the most silent and common diseases, diabetes, can cause progressive numbness, even in people who believe they have their glucose under control. Knowing how to recognize this pattern makes all the difference. Cause 5. Diabetes, the silent villain. Diabetes is one of the most frequent causes of numbness in the hands and, principally, in the feet. When glucose remains high for a long time, it gradually damages the nerves, causing so-called diabetic neuropathy. This process starts subtly, with mild tingling, a sensation that the feet are numb, or even a feeling that one is stepping on something soft. Many people only notice when the symptom is already advanced, because the numbness tends to evolve slowly, which facilitates adaptation and delays diagnosis. Besides numbness, diabetes can cause burning, sharp pain, exaggerated sensitivity, or, in some cases, almost complete loss of sensitivity. This greatly increases the risk of wounds and infections in the feet, which can worsen quickly if not noticed. In the next topic, you will discover in which situations numbness requires immediate attention and when it can indicate something more urgent happening in your body. This is an essential part to avoid serious complications. When to see a doctor immediately, there are situations where numbness in the hands and feet cannot wait. When it appears suddenly, accompanied by weakness, difficulty speaking, intense dizziness, or loss of movement, it can be a sign of something much more grave, like a stroke or an acute neurological problem. Another warning point is when the numbness worsens rapidly in a few hours or days, without apparent explanation. These signs indicate that the body is going through a major alteration and that medical evaluation should be done as soon as possible. It is also fundamental to seek help if the numbness comes accompanied by strong pain, change in skin color, sudden swelling, or wounds that do not heal, especially in people with diabetes. These signs can indicate a circulatory obstruction, infection, or advanced nerve damage. In the next topic, you will understand what other symptoms, when appearing together with numbness, increase the risk even more and deserve special attention to avoid complications. If this information is helping you, share your support by leaving a like and subscribing to the channel to follow our upcoming content. Associated signs that increase the risk. Besides numbness, some additional signs can indicate that there is something more serious happening in the organism. Sensations like intense burning, loss of balance, difficulties holding objects, or frequent stumbling show that the nerves might be suffering deeper damage. When these symptoms appear together, they reveal that the body is losing part of the ability to communicate between the brain, muscles, and extremities, which demands redoubled attention. Ignoring these signs can make the condition evolve faster than you imagine. Another important point is to observe visible changes in the extremities, such as paleness, turning purple, swelling, or a sensation of constant cold. These signs, when combined with numbness, suggest that circulation and nerves might be compromised at the same time. In the next topic, you will see what can be done right now with simple and practical measures to relieve numbness and help the body recover part of the function that is being impaired. Stay tuned, because applying these actions early makes all the difference. What you can do today to relieve numbness. Some simple measures can help reduce numbness and improve nerve and circulation function. The first of them is to move your body daily, even if just with light walks of 20 to 30 minutes. This activity stimulates blood flow and reduces nerve compression caused by long periods of sitting. Another important action is to check your posture, adjusting chair height, avoiding crossing your legs for too long, and stretching arms and legs throughout the day helps relieve tensions that worsen tingling. Taking care of your diet also brings rapid benefits. Consuming foods rich in B-complex vitamins like eggs, meats, and legumes, in addition to maintaining good hydration levels, helps the nervous system function better. Reducing sugar consumption and controlling glucose is essential for those with prediabetes or diabetes, preventing greater damage to the nerves. In the next topic, you will discover which daily habits might be fueling the problem without you noticing, and why avoiding these practices can completely change your experience with numbness. What to avoid so as not to worsen the problem. Some common habits can intensify numbness and prolong discomfort without the person noticing. Staying seated for too long, crossing legs frequently, or keeping the neck tilted for long periods are attitudes that compress nerves and impair circulation. Furthermore, excessive cell phone use, mainly with the head tilted downward, can aggravate problems in the cervical spine, triggering numbness in the hands. Adjusting these small behaviors already greatly reduces symptom intensity in daily life. Another factor that many people ignore is the prolonged use of certain medications, like some for heartburn or gastritis, which can decrease vitamin B12 absorption and worsen tingling. A sedentary lifestyle and high sugar consumption also accelerate nerve damage, especially in those with diabetes. In the next topic, you will see how to tie all this information together to understand exactly what your body is signaling and which paths to follow to protect your health. If this content is making a difference for you, take the opportunity to leave your like and subscribe to the channel so you continue receiving guidelines that help with your well-being. Tying it all together and reinforcing the next steps. Numbness in the hands and feet is a sign that should never be ignored. As we saw throughout this video, it can be caused by poor circulation, nerve damage, vitamin deficiency, spine problems, or even by diabetes. In many cases, it is the way the body finds to alert that something needs to be adjusted immediately. Observing when the symptom appears, how it evolves, and what signs come along with it helps to identify the cause and seek the right treatment before the condition advances. Now that you have understood the most common causes and know when you should seek help, it becomes much easier to make decisions that protect your health. Adopting better habits, adjusting your diet, paying attention to associated signs, and avoiding behaviors that worsen the problem makes all the difference as years go by. Continue following our content to keep your body in balance and identify early any alteration that deserves attention. Taking care of your health is always the best path, and you have already taken an important step today.